Have you heard of the saying that a weeping uterus is a respecter of no one? By the way, what does it mean for the uterus to weep? Stay with me. The topic is postpartum hemorrhage. Post means after. Partum means childbirth. Literally, postpartum hemorrhage means bleeding after childbirth. Clinically, postpartum hemorrhage means loss of blood of more than 500 ml or any amount of bleeding following delivery up to the end of 6 weeks following delivery, which adversely affects the general conditions of the mother. Postpartum hemorrhage is a life-threatening emergency, and it is the commonest form of obstetric hemorrhage. It is a major cause of maternal death, both in the developing and in developed countries. There are two types of postpartum hemorrhage. We have the primary and secondary. Primary postpartum hemorrhage is when bleeding is within 24 hours following delivery. Secondary postpartum hemorrhage is when bleeding occurs 24 hours after 24 hours up to 6 weeks following delivery. Why did the uterus weep after delivery? There are 4 major causes, and they are called 4 T's. The first T stands for tonicity, uterine atony. What this means is that after delivery, the uterus ought to be stony hard. If it is relaxed, it is flabby, there's a tendency that it will bleed. So that's uterine atony. This causes 80% of postpartum hemorrhage. The second T is tissues. What the uterus wants is to be completely emptied. It is like a very strict landlord. Once the tenant goes, the uterus wants all the properties that the tenants lived with to be removed, else it will weep. And these properties are placenta, membranes. The uterus wants them to be removed. If you fall short of this, the uterus will weep bitterly for you. Then third C is trauma. Lacerations, episiotomy. If your baby tears you in the course of delivery and it doesn't get sutured, maybe delivered in a TBA home or in a place where the person does not know how to suture, you might bleed severely from it. Then the fourth one is thrombopathy. This just means that there's problem with blood clotting. So the blood is not clotting and the woman is just bleeding. And some women are more likely to have postpartum hemorrhage than others. Yes. And these are called risk factors. There are many. We have previous history of postpartum hemorrhage, grand multiparity. You've had more than 5 children. Antepartum hemorrhage, you bled before delivery, so you may bleed after. Uterine fibroids, retained dead fetus. There are so many reasons why a woman will bleed. So I listed them at the description box of this video. How do I recognize postpartum hemorrhage? First of all, chances that you are not able to know that you are having postpartum hemorrhage by yourself are high because of the normal vaginal delivery and post-delivery called lochia, which of course is red in color for the first few days. It can confuse you. Then secondly, bleeding may be confined within the uterus and it will not trickle down the genital tract, so you will not know that you're bleeding within you. Number 3, the euphoria of childbirth can be a distraction for the mother, and that's why you need to deliver where you be properly assessed at intervals, because once your vital signs are checked and any abnormalities will be spotted immediately, like low blood pressure, weak steady pulse and all that. So what are some features to serve as red alerts? The first feature is continuous significant blood flow after the delivery of your baby and placenta. You just notice that your pad is getting soaked so fast, flowing very well is a red alert. Number 2, flabby uterus. Remember I told you that the normal uterus after delivery is stone hard. Anything short of it is a risk. Then dizziness and fainting spells, another red alert. Paleness and sudden weakness, cold extremities, shivering post delivery, probably will be showing that something is going on wrong. So what should a woman do when her uterus weeps? The first thing to do is call for help. Shout out wherever you are. It is better you call and it's a false alarm than you keep quiet and the situation becomes a full emergency. Because postpartum hemorrhage is a respecter of no one, it is advisable to have your delivery in a hospital with facilities to attend to you. If in case you were already discharged from the hospital, let's say secondary postpartum hemorrhage, please call the hospital emergency number for an ambulance. If you are in a rural area or you don't have a hospital emergency number, please ask to be transported immediately to the hospital. This is not the time to go to your grandma's place or go to your mom's place or go to a TBA's house or to speak in tongues for the bleeding to stop. Hospital, please. While you pray, be on the move, straight to the hospital. And en route to the hospital, while you're going, put your baby to breast. Suckling of the nipple by the newborn causes the release of oxytocin, and which helps to contract the uterus. And remember, most likely cause of postpartum hemorrhage is uterine atony, that's flabby uterus. So you need the uterus to be contracted. Whatever you do, oxytocin will help, to contract it. Don't let them take baby away from you while you're going to the hospital. Unless you're too weak to feed baby to breast, then avoid hot drinks or hot rooms, like heating up some herbs for traditional home care of a woman that just gave birth. Please avoid those things because they will intensify the bleeding. And again, please be compliant. If you're asked to get some pints of blood in the hospital, intravenous fluids like drip, medications, injections, please comply. Don't argue, don't be angry. Even if you delivered also and you came back and they asked, please just do them. Blood is replaced with blood. That's the safest. Blood for blood. So how can I prevent my uterus from weeping? Prevention is better than cure, always. And also, PPH is one of those conditions you may not be able to prevent at home. It is best prevented by what we call AMSTEL, active management of third stage of labor. This is what is done in the hospital, so it's not for you to do. Number 2 way of preventing it is to recognize the presence of risk factors and to tackle them. So this is what will be done for you during your antenatal care. You really need antenatal care where the risk factors will be recognized and taken care of. And then in fact, KIV, your folder is KIV, you're kept in view if you have a risk factor for PPH. And then after delivery, you're monitored in the postpartum ward for your discharge home. PPH is the commonest cause of maternal death, and we must recognize it and kill it before it kills any one of our own. Remember, every mother has the right to life while giving life to another. If you know better, you surely do better. Please share this video with everyone. You may never know how far an act of kindness of sharing this video will go, and how many lives it will impact, and whom you will save by sharing this video. And please feel free to use the comment section for your personal questions, for recommendations, and for your experience. Once again, thank you very much for tuning in to learn. See you again. Thank you.